Mr. President, I want to start by thanking my colleague from New Mexico, Senator Udall, for his advocacy on behalf of the pieces and parts of our healthcare system that are so important to the state of New Mexico. Things like rural hospitals, opioid treatment, Indian country. He's been an incredible champion on those, and that's part of the reason why both of us come to the floor today, given what's at stake. Last month, President Trump and House Republicans rushed through a disastrous health care bill that would leave average New Mexico families paying thousands of dollars more for less health coverage. It would destroy the Medicaid program as it currently exists in our state and throw our entire health care system into chaos. And now Senate Republicans are drafting their own version of a similar health care bill in complete secret, behind closed doors, with absolutely none bipartisan input. This lack of transparency and departure from regular order it's unacceptable and it's deeply irresponsible, especially when every single American family's health coverage is at stake if this bill ever becomes law. While we don't know for sure what Senate Republicans' version of TrumpCare will look like, media reports say that it's shaping up to look more and more like the train wreck of a bill that President Trump and House Republicans celebrated in the White House Rose Garden just a couple of months ago. A bill that President Trump reportedly said in another closed-door meeting with Republican senators last week was, in his words, mean, quote-unquote mean, and cold-hearted. The House-passed TrumpCare bill is devastating to low-income families, to seniors, to Americans living with pre-existing conditions. This isn't so much a health care bill as it is a tax cut for the ultra-rich masquerading as health reform. You don't have to take my word for it. You can look at how the nonpartisan Congressional Budget Office described its projected impacts of the House-passed TrumpCare bill. According to the CBO's analysis, TrumpCare would strip 14 million of their health insurance next year and 23 million by 2026, all to give tax breaks to the wealthiest of Americans. That's reckless, and frankly, it's inexcusable by any measure. How would the bill do that? The House-passed bill, which again seems to be the baseline for the ongoing secret negotiations here in the Senate, would slash funding for the Medicaid program by hundreds of billions of dollars and end the need-based tax credits for individual health care market plans under the ACA. I've heard from so many New Mexicans who have told me how access to health care coverage has helped their families and in some cases even saved their lives. I recently met with patients at the Ben Archer Health Center, a rural health clinic in Hatch, New Mexico, and heard firsthand how important Medicaid coverage can be to families in southern New Mexico. One of the New Mexicans I met there was Anna Marie, a Las Cruces native who worked for the Las Cruces Public Food Service for 22 years. Anna Marie's husband passed away in 2008, and when she found herself unable to keep working following a minor stroke, she could not afford health coverage on her own. When she reached out to my office last year, she had bronchitis and walking pneumonia. My staff helped her enroll in Medicaid, and now she's able to get access to the care that she needs. I want to take a moment to explain why the Medicaid program is so critical in my home state of New Mexico. As a Medicaid expansion state, New Mexico has seen dramatic gains over the last 5 years in coverage for the folks that need it the most. Stories like Anna Marie's illustrate just how important Medicaid can be for hardworking New Mexicans. Medicaid currently provides affordable health coverage to over 900,000 New Mexicans, including many school children, seniors in nursing homes and long-term care facilities, people with disabilities, and people who need treatment for mental health and addiction. Just one example of the wide-ranging consequences of the Republican health plan's drastic cuts to the Medicaid program would be the end to any possible progress we've made so far in fighting the opioid and heroin epidemic. The opioid addiction epidemic has been deeply felt in communities across the state of New Mexico. For years, without adequate treatment resources, our state has suffered through some of the highest rates of opioid and heroin addiction in the nation. And I would just note that today a story came out about how we hospitalized in the ER and long-term care or hospital care 1.3 million Americans last year because of this epidemic. However, when provided with an opportunity to receive comprehensive treatment and rehabilitation, people who've suffered through the trials of opioid addiction can and do turn their lives around. Evidence-based treatment works, but it's only possible when we devote real resources to pay for it. And so much of that comes directly through the Medicaid program. As you can see on this chart, Medicaid pays for 30% of opioid medication-assisted treatment in New Mexico. 30%. It's the foundation that you build on for opioid treatment. And in states like West Virginia and Ohio and Kentucky, Medicaid pays for nearly half of opioid treatment payments. This came up just last Friday when the White House hosted its first meeting for President Trump's Commission on Combating Drug Addiction and the Opioid Crisis. Now, the president's top advisors probably didn't hear what they would have liked to from the advocates who've been on the front lines of fighting the growing opioid crisis. For example, Dr. Joe Parks, the medical director for the National Council for Behavioral Health, told the president's commission, quote, "Medicaid is the largest national payer for addiction and mental health treatment. Since the majority of increased opioid deaths and suicide occur in young and middle-aged adults, which is the Medicaid expansion population, the Medicaid expansions must be maintained and completed," end quote. It is nothing short of hypocrisy for the Trump White House to claim it is taking steps to address the opioid epidemic when it is helping Republicans in Congress push through legislation that would end the Medicaid program as we know it, slashing hundreds of billions of dollars in federal funding from the Medicaid program, which will ultimately pass all of those costs on to the states. Let me give you a sense for just how big a burden that would be. In New Mexico, it's estimated that our state government would have to either come up with a way to raise $11 billion of new taxes over the next decade, or cut the equivalent amount of coverage for hundreds of thousands of New Mexicans who rely on the program. That is a hit to the state budget of $1 billion+ a year. This would have an especially hard impact on our state's rural communities. When you go to small towns in New Mexico like Clayton or Raton or Santa Rosa, as I did last fall on a rural health care listening tour, you see right away the vital role that hospitals play in rural communities. In most cases, these hospitals are the only healthcare providers for many miles in any direction. And hospitals are also often the major employer in these small towns. Rural health providers face enormous challenges because it is financially difficult to care for populations that live over vast spaces and are on average older, less affluent, and more prone to chronic diseases than those in more urban and suburban communities. Medicaid expansion and the need-based tax credits for individual health care market plans in the ACA have been critical financial lifelines for rural health providers. Thanks to the coverage gains that we've seen in New Mexico, instead of seeing uninsured patients coming to the emergency room during expensive medical emergencies, our rural health providers are able to help New Mexicans live healthier lives with primary care and a preventative medicine approach. And when medical emergencies do arise, New Mexicans have coverage that helps rural health providers cover those expenses. If President Trump and Republicans in the Senate pass their health care bill, that all could go away. And some of our rural health providers may very well have to close up shop. Right now, more than 1/3 of rural hospitals are already at risk of closure. But if you look at where the hospitals that have been forced to shut down in recent years are located, they are almost all in states that chose not to expand Medicaid. We should learn a lesson from that, Mr. President. I know for a fact that if hospitals shut down, healthcare delivery in rural New Mexico would be decimated. And economic impact would be severe in these small towns. It's estimated that when a single hospital closes in a small rural community, nearly 100 jobs are lost, taking more than $5 million directly out of the local economy. A recent report by the Economic Policy Institute estimates that if Congress passes TrumpCare into law, New Mexico alone would see a loss of almost 50,000 jobs by the year 2022. Thanks in large part to the major coverage gains that we've seen under the ACA, the healthcare sector has been New Mexico's strongest area of job growth for the last 5 years. New Mexico added over 4,000 healthcare jobs in 2015 alone. A couple of months ago, I met with students at Central New Mexico Community College, C&M in Albuquerque, who are training for those healthcare jobs. These bright young people want to make careers out of making their communities healthier and safer. But with this dangerous legislation moving through Washington, they are all worried about what it might mean for their future career plans. Why would we want to rip the rug out from under them by wreaking havoc on the nation's healthcare system? Again, you really have to ask yourself, why are Republicans so intent on rushing through a massive piece of legislation before we can even understand its potential harmful consequences? As I said earlier, I have heard from literally thousands of New Mexicans who have called in or written or come up to me on the street to oppose this legislation. Many of them have told me how it will directly impact their families. I could pick any one of these stories to demonstrate what's at stake in this debate, but I'll leave you with just one. Brittany from Aztec, New Mexico, wrote to me about her 2 young children who were diagnosed with a rare form of food allergies that created absolutely unaffordable costs through her husband's employer-provided health plan. Brittany said that she and her husband were averaging 3 doctor's visits a week and were, quote, barely keeping their heads above water from paying copays, end quote. After applying for Medicaid, she and her husband have full coverage for their children's medical costs. Brittany wrote to me and said, "For us, Medicaid is literally life-saving. Please do not take away this program or any of the ACA. It may not be perfect and could use some work, but taking it away altogether would be catastrophic for so many people like my family." That's what she wrote to me, Mr. President. I want to urge President Trump, and I certainly want to urge my Republican colleagues here in the Senate, to listen to that urgent message. It's time to turn the page on the disastrous policy path that is repeal and replace, so we can finally get to work on actually fixing those things in the current healthcare system that we all agree need work. Our common goal, regardless of whether we're Republicans or Democrats, that we should all be working towards is making quality healthcare more accessible, more affordable for all Americans. I would welcome a good faith effort to tackle that challenge, because healthcare policy shouldn't be a political football. It should be about giving peace of mind to the millions of Americans like Anna Marie in Las Cruces, like Brittany in Aztec, who are only one diagnosis away from a crisis if we don't get this right. Thank you, Mr. President, and I would reserve the balance of my time.